Hi, my name is Theng, and today I'm going to present my review of the Association of Private Hospital of Malaysia, named as APHM. There are 1,000 of conference delegates and 3,000 of exhibition visitors to grace this conference. The total number of participants was broken down to several groups, which included senior management and the manager level participants, which included the sales, marketing, technical, housekeeping, and operations, among others. Also, the mid-levels executive included the business development, accounts, sales, operations, and others. Also, the medical equipment planners group and the last group are doctors and nurses. For the need analysis, they guide on how to get the conference to make the conference interesting and excited. Secondly, to make special accommodation to all the speakers and prior the several accommodation providing agency in regards to the conference to ensure accommodation availability. For the venue selection, APHM was held an annual APHM International Conference and Exhibition on 29 July 2019 from 8 a.m. to 6 p.m. at Kuala Lumpur Convention Centre in Hall 2 and Hall 3 in Level 3. The venue of the conference was selected based on the several factors such as the comfortability offered in all sessions as well as the availability of a space to relax during breaks. And also, the nature of the conference required a special conference center providing for several activities, at the same time being the newest, largest, and most diverse exhibition venue in Malaysia, as well as it is easy in accessibility from all corners of the country. This was to provide convenience in offering transport and accommodation service for the guests. The organizer objective for the conference were to increase clinical governance awareness, to increase clinical effectiveness, increasing awareness on corporate governance and its impact on clinical effectiveness to introduce the roles of governments in healthcare system. And for the attendees' objective, the objective from the conference include understand the role governance in clinical effectiveness, experience the technique of understanding through illustration, and to experience some of the most recent innovative models. For the program content, the conference focused on corporate governance and clinical governance, which are included opening ceremony, a talk on healthcare governance, address on corporate and clinic governance in health sector, address on clinical governance and its impact on private hospital sector, a seminar on corporate governance, and a panel session. As such, the main content for the day was corporate governance and clinical governance and the impact on private healthcare center. Corporate government ensure efficiency, measure quality, and aid in research and share learning. On the other hand, clinical governance includes staff management, patient and public involvement, information gathering, risk management, auditing, and education and development. These are the 3-day schedules which I have explained in the previous slides. Evaluating the effectiveness of the conference, this conference was a success conference as it brought together professionals who aid in elaborating on these theme topics. As well, the exhibition presented showed the level of innovation within the healthcare sector. The conference was also able to obtain its primary interest. The topic of conference and clinical governance were widely expounded on. And the most importantly is, this conference has held in every years.